Recently, there has been growing concern about melioidosis, a serious bacterial infection that has started spreading in areas previously thought to be low risk. This infection, traditionally seen in tropical regions, is now emerging in new territories, prompting healthcare professionals to reassess their diagnostic and preventive measures. Melioidosis is caused by the bacterium Burkholderia pseudomallei, which thrives in soil and water. The infection can be contracted through direct contact, inhalation, or ingestion of contaminated materials. The symptoms can range from mild fever to more severe pneumonia or bloodstream infections, and if not treated quickly, it has a high mortality rate up to 40%. Experts are taking notice of the rise in melioidosis cases. Dr. Emily Chen, an infectious disease specialist, notes, the recent spread of melioidosis beyond its traditional endemic areas is alarming. Climate change, with its increased rainfall and flooding, might be helping B. pseudomallei spread to new places. Healthcare providers need to stay alert, especially when dealing with patients showing signs of sepsis or other serious conditions. Dr. Raj Patel, an epidemiologist, stresses the need for better surveillance and reporting of cases, as well as investment in rapid diagnostic tools. Early detection, he explains, is key to improving treatment outcomes. Additionally, Dr. Maria Gonzalez, a public health advocate, points out the importance of public awareness campaigns, especially in areas affected by flooding. Simple measures like wearing protective clothing and ensuring clean water supplies can make a big difference in reducing infection rates. In terms of statistics, Australia has reported at least 16 deaths from melioidosis in 2025 alone, following significant flooding. Regions affected by heavy rainfall and flooding have seen a noticeable rise in melioidosis cases, which underscores the environmental link to its transmission. A real-life example of this came from North Queensland, where a farmer cleaning up his property without protective gear developed severe respiratory symptoms after wading through floodwaters. Despite receiving intensive care, he succumbed to the infection. This tragic case highlights the serious consequences of melioidosis and the importance of preventive measures. Healthcare professionals can play a critical role in curbing the spread of this disease. Staying informed about emerging diseases and keeping up with regional health trends is essential. Educating patients, particularly those in at-risk populations, on preventive actions, especially after natural disasters, can help reduce the spread. It is also crucial to consider melioidosis in differential diagnoses when seeing patients with compatible symptoms and potential exposure histories. For further reading on this growing threat, check out articles on melioidosis from reliable sources like the Australian, Relief Web, and Contagion Live, which all offer insight into the rising cases and the steps being taken to address the issue. By staying vigilant and informed, medical professionals can help prevent the spread of melioidosis and other emerging infectious diseases.